Hello, readers. Mark Gentili, the editor of Sudbury.com, joining you once again live from our boardroom here on 158 Elgin Street. Today we are sitting down. I'm really grateful and appreciative that the Medical Officer of Health for Public Health Sudbury Districts, Dr. Penny Sutcliffe, is joining us for a live chat today and to answer some questions concerning COVID-19. So Dr. Sutcliffe, very much appreciate your time today.
Thank you very much.
I just want to, how are things going? I know you are probably the busiest person in the city at the moment. I assume a lot of our readers are wondering how you're coping in this pandemic environment that we now find ourselves in.
Well, that's kind of you to ask, and I have to say that I am surrounded by a lot of very busy and dedicated people also, so we are nose to the grindstone and doing all that we possibly can right now for our community, but thank you.
I guess this is the kind of thing that, this sort of situation is the reason we have public health, I would think, or a big part of the reason we have public health.
Well, I'd like to say absolutely to respond to issues like this when the community needs us, and also to invest in the longer term, chronic disease prevention, tobacco, mental health, poverty, all of those issues also, but certainly to be able to be there to respond to urgent issues is incredibly important.
Yeah, it's a big binder that public health is responsible for.
That's correct.
So last week on Friday, Premier Doug Ford released projections, infection rate projections, death toll projections that the province is working on, and he said that he was doing this because he wanted people to understand not only the scope of how bad this pandemic could be, but also the impact that the measures that Ontarians are taking to try and limit the spread and try and flatten the curve and all of these sort of hashtags and terms we are now all familiar with. I was kind of wondering if those sort of projections were available for our region, and if that was something that you would be willing to talk about.
Right, and so the release of those numbers last week really was an eye-opener for a few reasons. I think for me also, how bad things could be if we're not taking the measures that we're taking right now, but also how good things can be if we continue and we really maintain those measures of distance. Extrapolating those numbers for a region that compared to the rest of Ontario was relatively small, so Sudbury Districts, is very difficult to do. It can be done, but the ranges end up being so huge that they're kind of meaningless. So really what I take from that is not so much the numbers for our area, what does this mean in terms of cases or even deaths into the future, but more about the importance of us maintaining these areas and really keeping strong and keeping that physical distance. And in the absence of treatment, specific treatment and vaccines, that is all we have, but we have a lot. We have a lot of ability to change the trajectory and to flatten that curve and to protect our valuable healthcare system.
Okay, so if it's too hard to sort of to make predictions or projections, how do you go about as the medical officer of health? How do you go about planning our response to it if the numbers are so widely varied?
That's a really good question. And so we do the old adage of, planning for the worst and hoping for the best. And so our staff, as you mentioned earlier, we really are working flat out to manage what we have now, and that's the 26 confirmed cases and all of their contacts and further follow-up. So obviously, when we get more cases, there will be more work attached to that. So while we need to make sure we respond to what we currently have, we also need to keep our eye on the future. And so that means things like technological advances. So what could we do, technology that might help us to streamline some of our case and contact follow-up. It also means making sure that we cross-train our staff so that it's not always dependent on the same people to do the case and contact management, but that others are also able to. We also know, and it was announced provincially, that others are being drawn into this. So it could be volunteers or students or people who are retired. So I fully expect there to be additional resources to help and assist us when we need it. I do expect those resources will be needed in larger centers sooner than they will be needed in smaller centers.
Okay. Is the sort of the geography, the demographics of Northern Ontario, particularly, of course, our region, the Sudbury and Manitoulin districts, I'm kind of curious if, like you had mentioned earlier, that the north situation is different from the south. So there's population densities and things like that are all different. does the geography and the sort of the population density of Northern Ontario, does that help with limiting the spread of infectious agents or infectious diseases like COVID-19?
I think, excuse me, I think it's a bit of a blessing and a curse. I've been talking too much, excuse me. A bit of a blessing and a curse because we are somewhat protected because we are in the north, we're more remote, we're more removed. Now there certainly is less travel to larger areas. However, we also know that when the virus is introduced into our communities and there is spread, that we can more easily be overwhelmed, our healthcare system more overwhelmed, our community's capacity, et cetera, overwhelmed. So those are absolute concerns. And so the message now about staying home really does mean that. And I know some people have said, well, does this mean that we shouldn't, we should stay in our community or that we should have boundaries? And actually, no, we should just stay home. And this is really as simple as that. And then that is what we can do. And I think that we have a better ability to do that in the north. We're not as concentrated. Fewer of us live in high rises or condominiums, et cetera. So I think that the mental health toll and our ability to comply with that is actually really greatly enhanced with the north. And for many of us living in areas where maybe we have backyards, so we can actually go out and maintain our isolation while still getting some fresh air and protecting our mental health.
Okay. So people can still go out and should still go out and walk around as long as they're keeping a safe distance from others.
People who are not being told to self-isolate for specific reasons can go outside and walk around, certainly maintaining distance, as you have said. And thankfully, we have a lot of opportunity to do that. We do know that in Sudbury, for example, areas like parks, the boardwalk are now closed because it was finding quite difficult to maintain distance in those areas. But there are other opportunities. And I would just like to say that with the holidays coming up, so with Passover, with Easter, where we will be tempted to get together with families in close quarters, we really cannot do that right now.
Okay, and I was going to ask you about that. We are coming up at the Easter and the Passover celebrations, always a time where families get together, but maybe now is the time to do those sorts of things like you and I are doing today in a kind of more of a virtual environment.
Absolutely. So distance matters. Distance matters. Distance really matters. So we absolutely can get together virtually so to maintain the social connection, but the distance matters. We must keep that distance to reduce the risk of transmission and spread in our communities.
Okay. Now, in the subject of transmission and spread, we are now it's now recommended, that homemade masks and things are things that we should be wearing when we're going to be in places where it's going to be difficult to physically distance ourselves from others, so grocery stores and that sort of thing. Can you just talk, I know we've gotten there's a bit of confusion now because originally Dr. Teresa Tam, the Chief Medical Officer of Health, recommended not using masks, and now the recommendation is that you should be using them. What has changed, and can you just kind of explain the switch?
Absolutely, and I think we should be really clear about this because it can be very confusing to people. There has been a change, there has been a significant change, and we might well expect that change as we are learning more about the science of this virus as time goes on. And so what has changed in our knowledge really has been the increased evidence about the potential for transmission or spread of this virus from person to person if an individual is not yet having symptoms. So I might not have a fever, I might not be coughing, but I might be infected. And in fact, I might be developing a fever and a cough later on, or I might never develop that. And there is increasing evidence that is a possibility. And so with that knowledge, I think it's very responsible for Dr. Tam and others to shift in the recommendations about what we should do to protect ourselves. Part of the concern, of course, is that the false sense of security, that if we put a mask on, we don't need to therefore wash our hands or keep our distance, and the concern that that would cause harm, as well as the fact that we might touch our face, in fact, if we're wearing masks. But in weighing the pros and cons of all of that in the light of this new evidence about the risk of spread, even in people who have mild or no symptoms, wearing a mask in public if you have no symptoms, especially if you're in environments where you don't think you can maintain or guarantee that 2 meters. So grocery stores, as you mentioned, or pharmacies, essential shopping that we might need to do, that there are more benefits than risks associated with that, as long as we continue to work on the social distance, so washing of our hands, not touching our faces, those kinds of things.
Okay.
And I should probably also just specify that those are non-medical masks. We must keep those medical masks for our healthcare providers. We know the supply is short, is what we understand globally. So those supplies need to be protected for our healthcare providers.
And if I understand correctly, and maybe you can correct me if I'm wrong, because I am only a reporter, the homemade masks do offer not so much protection for yourself, but protection or a degree of protection for those around you in the event that you yourself happen to be carrying the virus, right?
Well, thank you very much, only a reporter, for mentioning that, because you're absolutely right that the wisdom around this is in fact that you are protecting other people. So you might not have symptoms, but if you do cough, or even just in speaking, if some of those droplets are escape from you, that in fact you are protecting other people. It really has not been shown that these masks that we made from cloth from our own homes would protect us.
Right. So it is kind of a sort of an artificial way of getting a bit of a herd immunity in a way.
Well, in a way, it's sort of supplementing our distance. So where we can't keep a distance of 2 meters, and maybe it's a bit less, in fact, we're helping to enhance that by having this mask on. So effectively, we're helping to control and have that effective 2 meters, even if in fact, physically, we're not keeping apart by 2 meters.
Excellent. Now, protocol when it comes to masks and gloves. We're hearing, we've gotten some complaints, we're seeing some complaints in comment threads about people not properly using masks and gloves. Can you talk about that a little bit? Like what is the proper protocol if you happen to be using these protective devices?
So in the community, if a person is deciding, and this is voluntary and precautionary measure, to wear a mask that is not a medical mask, it really is for when you're outside of your home and when you are thinking that you will not be able to maintain 2 meters. Really important not to touch the front of the mask, to touch really the pieces that are going around our ears, whether those are elastics, the hairbands that we're using, or whatever, and to not touch the front of the masks. Really important also when we take them off, that we can just wash them in our regular laundry, but that we must wash our hands after we take them off, and again, that we don't touch those masks. Very, very important. On the gloves, and those gloves really haven't been spoken about too much, but gloves also can give a false sense of security. Hand washing is really what we must be doing. And cloth gloves to make sure that we don't then contaminate ourselves with the outside of the gloves. So going from the inside of the glove to take it off, and then washing our hands afterwards.
What sort of protection does the glove offer? Is it just, I'm not really quite clear. I mean, if you have the gloves on and you touch something that has the virus on it and then touch yourself, I mean, the virus is going to be on the glove. It's not like the glove's immune to viruses.
You're absolutely right. And perhaps if we, it gives us, again, a false sense of security that we are protecting ourselves, that really it is the hand washing that is so very, very important. It's a really boring message, I have to say, Mark, but it's so critically important.
Okay. The state of emergency. A lot of people sort of wondered why it's important. You yesterday, as well as HSN CEO Dominic Giroux, you both thanked the mayor and commended him for making the decision to go with a state of emergency. What's the necessity of that, do you think?
So I think that it helps to heighten the attention and the awareness on the issue. So that in and of itself is not unimportant. There's a lot of noise around COVID-19, and I think people can get a little tired of hearing about it all the time. I get tired of hearing about it all the time. But to really help us to stop and think again about, this is incredibly important. It's important for my community. It's so important that the elected head of our community has made this decision. It's not a small decision. So that sends a very strong message about the importance of this. I think from the mayor and council's perspective, it also helps with regards to streamlining of decision making. We heard the mayor say yesterday that there is nothing kind of on the docs with regards to decision making, but should there be a need, new bylaws or new rules, that can be done in a more streamlined fashion, that is also very important. He mentioned about the protection of volunteers through WSIB, workplace safety insurance, that is also an aspect of this declaration. in the context of a provincial declaration, it's arguably less important with regards to powers and that kind of thing. But I think for the reasons that I mentioned, it is a wise action for the municipality to take at this time.
Okay. So sort of a demonstration of leadership and a signal of how important this is, that kind of thing. It's kind of, I mean, obviously there are mechanical things that it can do, but there's some symbolism involved as well, I guess.
That's correct. And a state of, enhanced readiness, I think, is the other piece with it.
Right. Yeah, exactly. Another question we're getting a lot of: food service and groceries. A lot of people are not only getting meals delivered to them through services like Skip the Dishes, Dine Dash, things like that, but also when people are going out shopping for essential groceries and bringing them home. We're getting a lot of questions from people on how they're supposed to be dealing with products that they bring into their home, whether it's food that they've had delivered or whether it's groceries they picked up themselves. Should they be washing them? How should they be washing them? How should they be managing these things that people are bringing into their houses?
I've been a bit surprised by that question, but I've heard it also. So there is certainly no evidence of COVID-19 being transmitted through food. So that's one thing that's important to be really clear about. On the issue of the virus itself, and can it last on surfaces? Can it survive if it's on a package of something or on a tabletop? Absolutely it can. And depending on the surface and the humidity and the temperature, a couple of hours, days really. It really does depend. But that's for anything else, any other, bacteria or virus. And so I sort of think it's common sense. So what we would normally do, so washing our fruits and vegetables before we eat them, cooking things that are meant to be cooked, that are meant to be separated. I can tell you that I do not take any additional precautions at home to wipe off the pasta box or that kind of thing. I do think, though, that important hand washing, again, is so very, very important when we are preparing food, when we're taking food out of packages and then cooking that food and washing our hands as we go along, and washing our counter surfaces. All these things are so very important. People who are particularly worried, there is probably no harm in taking the time to, there is no harm in taking the time to wipe down the surfaces of your containers. That will be for people who are particularly worried and really not based on evidence or need to do that. Again, the hand washing is so important.
Okay, so really the primary, the big message continues to be wash your damn hands.
That's right.
Okay.
Well said.
Okay, now, people are nervous at this time, and people, they're anxious. People's anxiety is up. And I'm sure, you have friends and, you have a private life of your own besides being the medical officer of health for Public Health Sudbury. But what do you say to people when they say to you, like, I'm nervous about this. I have anxiety. Like I'm frightened about for my family. I'm frightened for myself. I mean, what can you say to people or what do you say to people to give them some perspective, help set their mind at ease?
Mm-hmm. Well, I think, Mark, that it's important to hear those feelings and to validate those feelings. That many of us, this is lots of unknown. I've worked here for 20 years. I haven't been through a pandemic before. So there are a lot of unknowns. And I think that acknowledging how we're feeling, taking a deep breath, focusing on the moments, so what it is that we're doing in the here and now is extremely important. Not to pretend we don't have those feelings or convince ourselves that we shouldn't have those feelings. Those feelings are real, whether they're valid or not, they are real for each and every one of us. The other thing I think is important to think about what it is that is in our control. What can we do? And as we said at the very beginning, we really do have a lot of control about how this virus is spread. So the simple things about not getting together at Easter, even though we really want to, and we always do, the simple things about only having one person go to the grocery store when it is necessary, not the whole family. We have a lot of control in how this is spread. And the other thing I think about are the older members of our community, those people who are more vulnerable because of age or because of underlying health conditions. They are counting on us. And so I think that, we need to roll up our sleeves and understand how we're feeling ourselves, but knowing that we have a lot of ability to help our families and to help those who will have more difficulty helping themselves if they do get infected with this virus. We are very strong collectively. I really do feel these aren't just little words, we'll get through this together, but we will get through this together. And we will get through this by really taking these simple but effective actions of staying home, washing our hands, and keeping our distance.
Excellent. Very good advice from Dr. Penny Sutcliffe. Dr. Sutcliffe, I really appreciate, I know you're busy, and I really appreciate you giving us some of your time today. And good luck. The community is counting on you, so we appreciate the work that you and your staff are doing on our behalf. And I want to thank you very much for joining me on Sudbury.com today. And to our readers, Sudbury.com updated every hour with the latest news, everyday news as well as COVID-19 news. Come to the site and get informed, and wash your damn hands. For
Thank you so much.
For Sudbury.com, I'm Mark Gentili. You have a nice day, Dr. Sutcliffe.
Bye now. Thank you.
Bye-bye.